Good evening. Welcome to the July 2023 Clinical Governance and Professional Practice Updates. My name is Stuart Woolley, one of the Paramedic Practice Leaders in CGPP, and today I'm joining from the traditional, unceded ancestral territory of the Stolas people in Agassiz in the Fraser Valley. We have a relatively short video for you this month, although there's lots of information in the emailed version. I have a couple of practice updates and a couple of educational updates for you. I'll begin with the practice updates. You'll notice in the handbook there's been a new addition to one of the clinical practice guidelines with some pre-arrival notification criteria. A new clinical reference tool has been added. This notification criteria has been co-created by paramedics, paramedic leaders and regional medical directors in collaboration with your local EDs. This tool aims to give paramedics a prompt for patient presentations that require a pre-arrival notification phone call to your receiving facility. This will allow the facility to get the appropriate resources they need and be prepared to receive the patients that we're bringing to them. However, we do recognise that there's going to be some patient presentations that do fall outside of these parameters. In these cases, we're asking our responding paramedics to please use your discretion when deciding to pre-notify a hospital about an inbound patient. And if in doubt, and we're not quite sure, simply err on the side of caution and complete a pre-arrival notification. More information can be found in the handbook, but if you have any specific questions, please don't hesitate to email us at clinicalpractice@bcehs.ca and we'll get back to you with an answer for you. For my advanced care paramedic colleagues around the province, it's a polite request. Can you please double check if you have your ACP Schedule 2 endorsement on your licence for treating palliative care patients at home with subcutaneous morphine? We know that there's been around about 69% of ACPs that have completed the training, but the information we've received is it's around 34% of those paramedics who subsequently have the endorsement on their licence. This quick 20-minute Learning Hub course only needs to be completed once. It will generate a certificate that you can email to getalicense@gov.bc.ca. This will then authorise you to administer medications as part of the palliative care A-Star to patients in the community. If you're looking for the course on Learning Hub, again, there's a link in the emailed version, but on the website, you can search for the course ID, which is 21774, and that will be able to link you to the course. For PCP and ACP colleagues, if you want some further information, the Palliative Lead courses for palliative care is now open again. They were just a single completion course, but now they're able to be done annually, and it provides a lot more information about our palliative patients in the community and the great support tools that we have as paramedics. So please do double check that one for me, and I'd be really grateful if you have completed the course and not sent the certificate, if you can re-download it and send it to licensing for me. PCP IV endorsements. As a department, we are really appreciative of all the paramedics and PCPs that have gone through the process to get the upskill from PCP to PCP IV. Our commitment remains steadfast in elevating all PCPs to the PCP IV status, which will then be a requirement for the Scope of Practice Bridging course later in the years. We're determined to work with clinical operations to support any staff that may need to come to a densely populated area with a high call volume in order to set you up for success to get the IV starts and then upgrade your license for this. And the final practice update we have for today is discussing the use of 12-lead ECGs, electrocardiograms with patients. Sadly, we've had several patient safety events recently where a 12-lead ECG has not been done on patients who have been experiencing or exhibiting signs of cardiac-related chest pain or atypical presentations within the health presentation to us. In every one of these cases, an underlying STEMI has been identified at the hospital, and these patients have subsequently received a significant delay in definitive care as a result. We're reminding everybody that a 12-lead ECG, it's a really fundamental component of investigations into complaints of chest pains, especially so in your atypical presentations or your unusual populations that we may encounter. We know that the 3-lead and the 4Y ECGs, they do not provide a diagnostic resolution required to identify the ischemia. and capture the STEMIs that we're missing. So please do continue to use them. And if we do a 12-lead ECG and there's no STEMI, that's also not a problem at all. We can continue treatment as standard. But if we do happen to catch a STEMI on these unusual presentations, absolutely fantastic. We know we have a definitive pathway now for some good care, and we're going to be benefiting the patient. Moving on to some medication updates. To help the shortage of manufactured ketamine that we're hoping is going to be resolved soon, there's going to be more places that will have access to the compound ketamine which is being created for us. This is going to include Vancouver Island, and it's also going to continue in the Lower Mainland where it's already available. However, with the compound ketamine, we're asking all paramedics to be really vigilant about the product's expiry date. It's only good for 28 days after compounding, so please do check this on every time you use some of these CTSs. There's going to be more guidance in the handbook about this and on the emailed ops update. And please, if we're using the compound ketamine in the pediatric population, we want to be really cautious, exceed some caution in pediatrics, and only use if it's strictly necessary. And again, there's more information in the printed handbook and the printed update for this for you. Some learning updates for us. For the ACP Continuing Professional Development courses, thank you for everybody that has already gone through the course. We are in the process of extending the course offerings, and there's going to be 2 new course offerings in Vancouver for ACPs who need to complete the CPD course. It's a fantastic day, going through some new skills, looking at the Tekel equipment and the McGrath intubation equipment, as well as some good skill refreshers for us and some great discussions throughout the day. The dates have been added onto Learning Hub and you can register for those. They'll be August the 12th and August the 23rd in Vancouver. And if you have a conflict in your scheduling with work, please work with your unit chief and your regional operational managers so you can attend those. There's a hyperlink in the emailed ops update for registration, so you can continue to register for that course. And thank you again for everybody that's gone through that. That's all for the ops update for this month. We'll hopefully see you next month. We know that summer is well and truly here now, and we're experiencing some hot weather all around the province. So please, when you're on shift, look after each other, look after your crewmates, continue to do the fantastic care, and thank you for everything you're doing in the sun. Keep hydrated, look after yourself, find that air conditioning. If you're off work and you're getting some downtime, please enjoy, be careful, be safe, and we look forward to seeing you on the next update and seeing you on the road. As always, if you have any questions, please don't hesitate to email us at clinicalpractice@bcehs.ca, or one of the paramedic practice leader team will be able to get back to you. Thanks very much. Take care.